program, we actually have oncologists that work with us. We have lifestyle medicine practitioners like yourself. So we realize that even among our own doctors, there is a wide, I guess, range of philosophy and approach to treating cancer. But for today, we know that you are like one of the authority in terms of treating cancer naturally. I wanted to ask you, the patients, even in the late stage colon cancer that you have helped reverse, did you actually use a combination of integrative like chemotherapy and lifestyle, or was this achieved purely on a lifestyle medicine approach?
Hear the knocking?
Yeah, I can hear the knocking.
Okay. Yeah, I apologize for that. I have no control over that, but it's a different. Oh man, it's pretty loud. Let me just tell you about some of the successes I've had.
That would be great. Right? Tell us the case studies.
Patients, they actually did undergo some regular intervention, like surgical procedures.
Yeah, for colon cancer, that's normal, right? Just cut it out first.
So they would cut out the tumor completely. For some of them, they had to get a colostomy because they couldn't, it was too big a chunk of colon that they could not re-anastomose or reconnect the colon. So they had to take it out and have a colostomy. For others, though, because they were small, they would just cut it off and then reconnect, and they would have normal bowel movement. So one of the patients that I'd like to tell you about was one of the first colon cancer patients I had, was stage 4.
Wow.
Okay, what they did was they simply cut the colon and then put it out. So they did not take the cancer away. It was there. Okay? It was still inside. And this was with my friend who was a nutritionist. Okay, a doctor in nutrition. Can you believe that? So what they did for 2 years, okay, they simply fed this person through a tube.
Wow.
They fed this person through a tube of blended plant-based whole foods. Wow. One of the main ingredients was brown rice. Can you believe that?
Yeah, wow.
And so this is what this nutritionist did. I was there to simply observe and learn, and of course guide in terms of helping with the nutrition part, right? And after 2 years, they couldn't believe it. The cancer had, the tumor had completely regressed, so that they could reconnect. They could reconnect the colostomy, they could reconnect.
Oh, wow.
And the person can poop again normally.
Wow.
Okay, so complete reversal, stage 4. It's crazy, but it's true.
Well, but for stage 4, it would mean that it had metastasized to other parts of the body. So
that's right.
How did you mean the tumors that metastasized to the other parts did they also regress?
They couldn't find it after 2 years.
Wow, fantastic. So for all the listeners out there who really are very excited about natural, there you go. There is that possible. There is hope. There is hope. At what point should they say, hey, maybe let's go and take a look at oncology again in combination with lifestyle medicine?
Absolutely. I mean, I work with oncologists as well. So I completely agree that if a tumor is very, very aggressive, okay, then we do have to stop its growth and stop its spread immediately. And of course, salads and fruits, you know, they won't cut the bill if you want to, if it's a very, very aggressive tumor. So yes, I do recommend these oncological interventions, especially for very aggressive tumors and very aggressive cancers. But apart from that, I also, of course, I primarily use lifestyle management. So I leave the oncologic interventions to the oncologists. They're the specialists in that. That is their field. But then I come in as supportive treatment with, things like the Simply Nature product. I use that a lot. Wow. PPARs, plus, of course, the proper diet. And I even encourage my patients to do exercise as much as they can, with what their limited movements may allow. So all these interventions I still do on top of the oncological treatment.
I think the biggest takeaway here is those of you who want to go natural treatment for colon cancer, first case example gives you lots of hope. But before you go all gung-ho, I think the best solution is to actually book a consult with Dr. Johann. To book a consult with Dr. Johann so that you will know how long you get to try and what's the right protocol so that you can get the good results. Dr. Johann, what other experiences can you share with us? So you shared this one, which is really amazing. What are your other experiences with colon cancer?
So that was a fairly middle to late age person, that first one I was telling you about.
Yeah.
But I had a recent cancer patient.
Okay.
She was a mother. Okay.
Wow.
And she had a tumor in her colon. What they did was they cut the tumor out and then reconnected her colon so that she could poop normally. Okay. And then she came to me. So she had the surgery done already when she arrived at my office. Right. So we did several tests. Her tumor markers were high. All right. So we still know that the cancer is active somewhere in her body. It's probably not manifesting as a tumor yet, but it's still there because the tumor markers, the CEA, was really high. So we did this. We did the lifestyle medicine, purely lifestyle medicine. She did not want to risk chemotherapy. She was afraid of chemotherapy. I mean, that's her call, right?
Yeah, that's her call. That's her
the
call.
Patient's decision. So she didn't want chemotherapy, and she was also taking care of a little baby. So, so there was a lot of things that she wanted to continue doing, and she knew that if she did chemotherapy, she might not be productive. She might not be able to take care of her kids anymore because
because there will be downtime. There will be downtime, especially the first few cycles. Yeah,
that's right. So I said, okay, let's do this then. So I put her on a completely plant-based diet. Okay. She is more strict than me now.
That is so rare for Philippines, right? Because most patients are so ill-disciplined when it comes to lifestyle change.
She's very strict with her diet. I absolutely salute her commitment. And also she got into a very active routine. So it was like I would say a boot camp thing for I don't know. They do all sorts of exercise routines.
Oh, wow.
It's crazy. It was like she was training in the army or something, But that's what she did. She was very committed to it. Wow. And so now it's like several years now. Okay, we've been following her up year after year. I think it's been 3 to 4 years now. Okay, and all her tumor markers have remained within the normal range. In other words, right now, she can literally be said that she has no colon cancer.
Wow, that's fantastic. And this was a stage 2, 1, 3 patient?
3.
Stage
3. Yeah.
Wow. So it did metastasize or it was just spread around the colon?
Yeah. Around the colon, there were some lymph nodes that they found, the cancer in. So yeah.
Doc, do you have any experience with colon cancer and using PPARs like our liquid extract with your patients? Yeah.
The second cancer patient I was telling you about, she went all in with the PPAR.
Oh, the one that you just mentioned, the one that's 3.
So she had liquid PPARs as well as the tablets. She was taking that, and until now she still takes the tablets.
That's why I was thinking, because seldom do people after operation and cancer able to do boot camp level soldier training. Yeah, but that's really common. I was wondering, was this patient on our extracts and tablets? Because then this answers my question. Yeah, because it really does help their recovery much faster. And of course, her discipline and lifestyle change is so key. Wow. But what, apart from family support, what are the other key factors that we should take note of so that we have a successful fight against cancer?
So if we have good support, then it's very easy to follow the other protocols, like the food. Nutrition is number 1. Exercise, okay, and of course when I talk about nutrition, since PPARs, as we know, is a very potent anti-inflammatory food, I use that because one of the main reasons why people get cancer is inflammation. Yeah. And we know that PPARs is anti-inflammatory, and that's why I have that as my main supplement when I'm dealing with cancer. And so apart from the PPARs, apart from the nutrition, the exercise, then other aspects come in as well, like drinking enough water, like sleeping enough hours, not getting stressed too much or being able to manage your stress, okay? Avoiding smoking, avoiding alcohol. These simple lifestyle changes are very powerful at helping individuals get healthy and, you know, gain back their health. So these are part of the protocols that I use.
Wow, thank you, Dr. Johann, for sharing that. And really, it does sound like family support is so important. I mean, it's so hard if you're trying not to smoke and all your brothers are smoking in front of you. It's so hard to eat a plant-based diet if everybody's eating crispy pata in front of you. I mean, levity aside, I mean, we want everybody to enjoy our programs, but this is a serious matter. However, there is so much hope. You know, Dr. Johann shared stage 4 cancer patient able to recover almost totally naturally. You know, and the other one is a stage 3 cancer patient who actually did go through surgical procedures and after that has been cancer-free for the last 3 years and doing well, completely normal. Well, if you want to have a successful fight against your colon cancer or in fact any other forms of cancer, Dr. Johann is available for consult, right? Simply drop us a note right now. Just type in right now that you would like to consult Dr. Johann and our healthcare specialist will help you arrange a booking and we will be there with you throughout the journey. We will be there to support you, your questions and also your protocols and and we look forward to having more of you share your wonderful stories of how you beat colon cancer. Dr. Johann, I think you have stirred up a lot of questions, so I can see there are many questions popping up. My team is telling me people are asking them questions. So if it's okay, any last words from you, encouraging words or words of wisdom or words of warning before we go into our live Q&A?
Yeah, so basically we want to do the basics. We want to follow the basics of keeping healthy by eating a nutritious, absolutely healthy, mostly plant-based diet. You want to be very temperate with your lifestyle. You know, too much indulgences can actually do you harm. So just make sure you're getting enough of all the good stuff and trying to avoid all the bad stuff. And I hope that we all remember there is always hope. As long as there's life in a person, there's always hope. So never lose hope. Never lose hope.
Doc, you know, when you say that, I couldn't help but see an image of the very heartwarming and heart-touching story of why you went into lifestyle medicine. About that particular patient of yours. I mean, thank you for sharing that with me, and it just flashed in front of my eyes when you said, you know, as long as life, there is hope. I remember what motivated you to go into lifestyle medicine. I want to encourage everybody and also, so take care. We'll jump right now into the live Q&A.
Thank you so much, Dr. Johann and Sir Shyan, for the very informative discussion. I'm sure that a lot of our viewers have learned so much from that discussion. Now, just before we go to our AMA, quickly, I just want to greet our avid viewers. Thank you so much for always joining and supporting our webinars and for helping us build a healthy community. And for our new viewers, welcome once again to Simply Nature webinar. I can actually see that there are a lot of questions coming in now, so let's not keep you waiting. To answer all our questions for tonight, let's call on our Simply Healed Medical Group Medical Director, Dr. Jansen and Mr. And for our PPARS expert from Singapore, Mr. Shyan Lim, he will be joining us as well in the few minutes. Good evening po, Dr. Jansen. Yun.
Hello, Sheila. Is everybody hearing me?
Yes, we can hear you.
Okay. So hello Sheila, hello everyone. Happy to be here again.
Thank you. I'm sure that a lot of our viewers are already excited because I can see some questions na po, Doc. And very interesting questions as well. Ha? So for the first question for tonight, coming from Miss Arionda Sean McQueen, is and people using laxative in people who are always constipated is of high risk for colon cancer?
No, not at all, not at all. Using laxatives and colon cancer, no, the risk is not related at all. Okay, so if you are someone who is constipated, no, and you want to use laxatives, feel free to do so. Actually, it's important, no, if you're constipated, for your bowel movement to a little bit more frequent, no, okay, to eliminate the toxins that's bathing your colon much faster and more frequently. Okay, actually, I would be more worried for patients who are constipated. Okay, because toxins would be swimming inside your colon um, much longer. Okay, and the risk for developing colorectal cancer is entirely dependent on the food that you're eating. So if you're eating a diet predominantly sourced from animal food products, then expect for your risk for developing colorectal cancer to go up. Okay, but not if if the fiber content of your diet is sufficiently high. Okay, so laxatives, no, it's not related at all with the development or the increase of developing colorectal cancer. Okay, so yeah, please be assured. Okay.
Thank you, Doc. Now I understand. You've mentioned something about fiber a while ago. Now I understand why you always include Cleansing Plus in your protocol. Okay. Thank you, Doc. Another question coming from Miss Khadija. Khadija Kasim. Can I still cure my PCOS? Or perhaps you might want to share, Doc, what are the ways to cure PCOS?
Yeah. Okay. PCOS or PCOS is polycystic ovarian syndrome, no? So polycystic ovarian syndrome is a hormonal it's an illness rooted in hormonal imbalance. Now, definitely yes, no, you can cure the PCOS, but of course, your lifestyle has to be fixed, no? It's always lifestyle first with PCOS. Next would be to make sure that your hormonal imbalances are corrected. Now, for PCOS, the general approach to lifestyle is number one, to go for a plant-based diet. Number two, you have to avoid dairy products because dairy have hormones that can, give you hormonal imbalances. Canned goods as well, no? So there are chemicals found in canned items, okay, like BPA, that acts very similar to hormones. So that's another thing that you have to take into consideration. And aside from that, of course, you have to exercise and make sure you also go see your OBGYN for your hormonal imbalances to be corrected. And not just OBGYN, you can also go look for integrative medicine doctors that are whose practice interest is more on the hormonal imbalances, no? So I know one such doctor. I don't know if you know her already, but Dr. Ruby Magpantay is a very good doctor that manages patients with hormonal imbalances. So she might be somebody you would want to talk to. Okay.
Thank you, Doc. All right. Just before we go to the next question, I'd like to introduce our another expert who will also help us answer questions for tonight. Our CEO and Director of Simply Nature International, Mr. Shyan Lim. Hi, Sir Shyan. Good evening.
Good evening and hi, Doc. I was just having dinner with Doc earlier and then I had to rush back here. So Doc managed to get onto the program before I did. So I hope you guys had a lively discussion before I was able to join in.
Yeah, we really have started answering the questions now, Sir Shyan. And we have a lot of questions coming in. All right, okay. So the next question, okay, coming from Miss Christine Borja. I am advised to undergo radiation while I'm having chemo. What is the purpose of having radiation since I will be operated anyway?
Okay, so you are being recommended, no, or you're undergoing chemotherapy and radiation therapy prior to the surgery. So the main purpose there is to shrink the tumor first before they cut it out. Okay, or else if they cut it out as it is, you might the bleeding might be too excessive and they might have to remove more than what is necessary because of the sheer size of the tumor. Therapy can kill off the cell, no? There are also chemotherapy medications or no, there are also chemotherapy drugs that pushes cells into this replication process. Okay, one such chemotherapeutic drug is cisplatin. Cisplatin is a radiosensitizer, so it sensitizes the tumor to radiation therapy. Okay, because there are areas in the body that is not sensitive to radiation. The radiation dose would have to be increased so to kill off the cancer cells in that specific area, and that dose usually can be lethal to your system, no? So that's why we use chemotherapy to lower down the dose of the radiation so that at lower doses which are safe, no, for the rest of your body, the cancer can die. Okay, so those are the purpose on why we give chemotherapy together with radiation therapy and why it is being given to you prior to surgery. Okay.
Wow, Doc, thank you so much, because I think we've always wondered, I'm sure some of the viewers wonder, why chemotherapy and radiation therapy together? Yeah, so that's really good. So just wanted to check with everybody, can you hear us? Is our audio back on? If you can't hear, please just let us know, send message, and we'll adjust our sounds.
Okay.
Sheila?
Okay. All right. Okay. So for the next question that we have here, coming from Miss Jennifer Caceres, what are the do's and don'ts if you have rectal cancer?
What are the do's and don'ts if you have rectal cancer stage 2B? Okay, I'm going to answer your question from a lifestyle standpoint, okay? Because this is something that I think would be, you can get benefit right from the get-go after, listening to this webinar. So do's and don'ts. Number one, okay, you have to consume a high-fiber diet, okay? A high-fiber diet has been shown, no, to help fight off colorectal cancer. And of course, to decrease the recurrence. Okay, so number two, what would be the don't? Okay, do not eat foods that are carcinogenic, especially red meat. Okay, aside from red meat, that would also be in general animal food products, because animal protein can make tumors grow. All right, so that's number two. Number three is make sure you do what your oncologist tell you to do, and follow their protocol, okay? Because the protocols that oncologists usually prescribe, uh, they really work for the case that you have, no? And another tip is, if your surgeon advises you to have it cut out, please have it cut out. Okay? The survival rate of cancers that the common cancers, the more common cancers that we have nowadays, the reason why the survival rate is so high is not because of the oncologic protocols. It's mainly because of surgery. If the tumor is not there, if the headquarters of the tumor is not there, then the tumor burden immediately goes down. The risk for metastasis goes down. Okay, because the headquarters is already not there. Okay, the base is not there, no, the base of the cancer cell. So if surgery would be applicable to you, have it have it removed. And actually that would be a good news even, because surgeons would not be recommending surgery if your case is already at the point where surgery will not be beneficial, instead it would do harm. Okay? So that means your body is strong enough, no? The reason why the surgeon is recommending surgery. Okay? So and
Oh, I think Doc froze over there, Sheila.
Yeah, a little bit. Yeah.
Yeah, so I just wanted to add to this point, surgery is really, really important. And if you have questions about surgery, what's the date of our live conference, Sheila? March?
It's March, happening this coming March 16, and very special at SMX Conference Center, SMR.
All right, so those of you who are in Metro Manila, you can make your way to SM Aura at the conference at SM Aura. So we're actually having a live face-to-face conference. The last time we had this was October 17th last year, and Dr. Jimmy Katapia is one of the top surgeons in Manila Medical City, and he is also an oncological surgeon and also a general surgeon as well. So he was able to answer questions about surgery. So one question I remember came from the audience. The audience actually asked if she needed to go for surgery, and Dr. Jimmy actually said no. All right, so doesn't mean that if you ask a surgeon if you need surgery, the answer will be a definite yes. So, but yet there were also two other persons there that day who actually made a decision to go for surgery after speaking to Dr. Katapia during the open mic Q&A. So this was not a one-on-one consultation. They asked these questions to the whole room full of attendees. And yeah, Dr. Jimmy, Dr. Jansen, and myself were all there. We were able to exchange. Can you imagine? I'm the PR expert, and Dr. Jansen is the integrative doctor, and then we have Dr. Jimmy who uses chemotherapy and is a surgeon. So it's really all different schools of medicine. It was a dream come true for all the participants, because they have all these doctors that usually will not sit together and answer the questions, not one-on-one in private, but really we had to answer the question. And when Dr. Jansen was sharing some protocols, the oncological surgeon was just right beside him. Right, and this is where, for many clients and patients, sometimes we always feel that doctors may give us conflicting answers, right? But when all of us are sitting together in front of you, all the answers will be harmonious. So it's really good, right? So this time around on March, we have another live face-to-face, and it's also available via Zoom. So check it out at the details later, so that you can ask the same questions that you're asking tonight, but you have a whole range of panelists ready to answer you live. Yeah. So mark that down on your calendar, and I hope to see as many of you there as possible. And you can catch our guapo Dr. Jansen in person. All right, yeah.
Exactly. Thank you, sir, for actually mentioning about that. One of the goals of that said event is actually to answer a lot more questions compared to what we had last time. So I do encourage everyone to register as early as now, because tickets are actually limited for the face-to-face. And yes, it is also hybrid, also available via online. All right?
Oh,
okay.
Sheila, I see a follow-up question, right? That if cancer is metastasized, does it recommend to do surgery? The answer is, if your cancer is metastasized, most of the time surgery is not even an option anymore. The surgeon cannot operate because it has spread to so many places. So, Dr. Jansen, is that correct? Doc, you're muted.
Unmute, please.
Yeah. Sorry, what's the question again?
Yeah, if your cancer is metastasized, most of the time, if it metastasized, surgery is not even an option anymore, right?
Yes, this is correct. I mean, surgery will not make sense unless the reason why you're doing surgery is to relieve some symptoms. Say, for example, you're feeling, okay, one example would be bowel obstruction. you keep on vomiting, you cannot eat properly, then the tumor that's blocking your digestive tract has to be removed. Another example is if you're feeling compression symptoms, no? You're feeling pain from a tumor compressing a part of your body, then the tumor would have to be removed. This is in context of metastatic disease already, no? But in general, if you are not feeling any symptom at all, you just have that tumor and you're generally healthy, surgeons will not be removing the tumor already. So in this case, because surgery will not help, I mean, it's you're already that the cancer is disseminated already. Removing the main tumor will not add any additional benefit, so to speak. Okay, so those are the situations where surgery can be applied and not be applied.
So it's really important to realize that, surgery is not an option that stays open forever. So once your cancer develops to a later stage, even if you want to use surgery, your surgeon might surprise you and say it's no longer an option. So definitely, if you're able to cut it out early, that would be a serious consideration. You should really look into it. Yeah.
Thank you, Sir Sean. Thank you, Dr. Jansen. Okay, another question coming from Ms. Ariana Deshan. Is it healthy to follow a vegan diet?
Okay. Before the doctor answer, can I make a jab at this?
Go, sir.
Okay, try.
All right, number one, okay. For those of you who are long-time viewers, you will realize that I hopefully look slimmer on camera. Okay, I actually lost 11 pounds in 1 month. Okay, so how did I do that? I did not do 100% vegan diet, but I cut down my meat intake by 90%, and of course I exercised more regularly as well, an hour a day actually, and I was able to lose weight. Blood pressure came down as well. Of course, during this time I was also on my PPAR protocols, and I want to share one thing with you. It does make a difference. So for even your sweat will smell different. Seriously, I'm not joking, not trying to gross anyone out here, right? And I was just sharing with Dr. Jansen, we had dinner together. I told him it's very easy to go vegan if you eat at the same place that we ate just now. Every dish was vegetarian, but it was so delicious, right? So yeah, Doc, is it advisable? Is it beneficial to go vegan?
The answer is it depends. Okay, it depends on what. Okay, so we have this thing we call a junk food vegan. Okay, remember
Okay.
French fries? Yeah, French fries is vegan. Okay, it's totally plant-based, but is it healthy? Come on. Everybody here knows the answer to that. I don't have to, I mean, you know it to be false, no? So if you are a junk food vegan, then you will get sick. Same disease at what everybody else gets: hypertension, diabetes, sometimes cancer, no? So what is a junk food vegan? You are eating processed, processed vegetables every day. So French fries is a processed vegetable. Oreos is vegan. Is Oreo healthy? Not really. It's not even a real food, right? So I know I'm saying that the food or the dietary pattern that you have to follow is a plant-based diet, which is, of course, no, it's true. It's a vegan diet. However, what I am saying here is to follow a whole food plant-based diet. Whole food meaning unprocessed, unrefined. You eat real food, vegetables, how you see them in nature, how you buy them from the market. It's how should be prepared and eaten. It should not be French fries. You do not see a plant that is called French fries plant or French fries fruit. Okay? Same thing with breads. No, you cannot see a tree bread tree, right? So eat real foods. Okay, so that's what I mean. All right. So there you go.
There you go, right? So yeah, someone McQueen said, huh? Oreos are vegan? Yes, they actually are.
Yes, at least the one that I know of, the original one. I don't know if they changed their recipe, but
Yeah.
as far as I know, Oreos are vegan. The original Oreos.
Because
They don't
yeah,
use dairy
Oreos
there.
actually contain lard. They at some point they changed the recipe. So yeah, there you go. Yeah.
Thank you, Doc. This is actually very useful, most especially for moms like me, because yeah, some of the moms' mindset is that yeah, this is potato, fries are potatoes. Or, yeah, they must know what should their kids should be eating. So there.
Yeah, you know, for those of you who are planning to eat more vegetables, when I just went for a healthy diet, so I'll tell you, you know, I'm not sick at all. I just have a bit of high blood pressure, all right, because of the stress of working with Dr. Jansen. No, no. Okay, so what I ate was I get cherry tomatoes, bell peppers, garlic, onion, and I grill them. I put them in what's the air fryer. I just drizzle a little bit, just a little bit of olive oil so that they won't be dry. And that's it, you know. Mushrooms. I eat a lot of mushrooms because number one, I really like mushrooms. So I stir fry mushrooms, very little oil. I don't put salt, don't put anything, just the mushrooms, and then I stir fry them with carrots. For example, just sliced carrots, very sweet because carrots are naturally very sweet. You don't need to add salt or anything. And then I just put them all together. Most of the time, I don't even eat it with rice. I may eat it with a tortilla in a wrap. And that's my dinner. Very, very healthy. Very delicious too. I always sprinkle some basil leaf on top when I put it in the air fryer. So you can try that. Really easy to cook. Doesn't take much skill. And it's delicious. And I can eat it almost like every day. It doesn't get boring for me.
Thank you, Sir Sean. Okay, another interesting question. This is actually like a follow up to what we were discussing, coming from Ms. Wen Carino. Doc, if surgery is not good or recommended for people who with metastasis already, is there any more option?
Yes, there are different options, no, for patients who have metastatic disease already. Number one is the protocol that your oncos recommend for you to do. I mean, depending on what kind of cancer you have, it can be chemotherapy, it can be immunotherapy, it can be targeted, it can be hormonal. Yeah, so those those are the protocol that your oncos recommend. Those work. Another one is in a situation where even chemotherapy is not applicable for you, or if your onco seems to have given up, yeah, I do IV vitamin C, megadose IV vitamin C therapy, which has been shown to also kill cancer cells, no? They're also quite good for against cancer stem cells, which are cancer cells that are not actively multiplying, no, a little bit dormant. Other option would be PPARs. PPARs I also use for metastatic disease. I actually combine different modalities. No, I combine IV vitamin C, PPARs, ozone therapy as well. Yeah, and the other supplements. I also use repurposed drugs. So repurposed drugs are medications that we have that we have right now, which are being used for specific purposes, specific diseases and illnesses, which have been shown to have anti-cancer effect as well. So I also use those. Okay, especially for metastatic disease, no? Yeah. So if surgery is not recommended already for you, these are the options that we can do. So really depends on, it would really boil down on your finances, really, and whether or not you would be willing to undergo the protocols that your onco recommends, no? But from the get-go, I would advise you to go see your onco first, then come to me, because whatever the onco prescribes, I will complement. Yeah, I think that would be the better term. So I won't be fighting against your onco. Whatever the onco is prescribing, I'll find ways on how to make it more effective and at least diminish the side effects that you will experience, no?
So I just wanted to add to this because if your cancer has metastasized, by the fact that it has metastasized, it means that the staging of your cancer is minimum stage 3, very likely stage 4. also possible. So this means that you're in a late stage of cancer. When you're at a late stage of cancer, it is very wise to use more aggressive forms of treatment because time is not your friend. Time is not your friend. The cancer is already large and spread. So there's this concept or this term called the doubling time of cancer. So that's the length of time it takes for your tumor to double in size. You know, you will also realize that once your cancer is in the late stages, it's also a bit bigger. So you must just imagine a small little marble doubling in size. It just becomes a big marble. But if you have a fist-sized tumor doubling in size, that's no longer two small marbles anymore. So at the late stages of cancer, we usually want to adopt aggressive approaches. However, the problem with aggressive approaches is that aggressive approaches like very strong radiation therapy or stronger chemotherapy or novel chemotherapy drugs is that they also have very strong side effects because you are attacking the cancer tumor so aggressively as well. So during this time, you are in a way quite stuck. On one hand, you have to use aggressive treatments. On the other hand, your body is also weaker than in the early stages of cancer. So what do you do? So what Dr. Jansen has prescribed and is suggested is exactly one of the better strategies. That means use the aggressive treatment that your uncle will recommend to you. And then at the same time, see Dr. Jansen so that he can manage the very strong reactions that will come with these very strong, protocols, right? Now, if the patient happens to be an older patient, for example, your dad or your mom or some relative, or a good friend who's in their 70s and 80s, you might want to not treat the cancer aggressively, but instead go for a palliative. That means you improve the quality of life. Now, even as we go for improving the quality of life, even for late-stage cancer, please understand this, right? Even if we go for, let's say, a natural, like Dr. Johann just shared in his video today, right, in the discussion today, even though it is still a Hail Mary, which means there is still a chance, all right? This is really important to realize. You know, even if you choose to go for palliative, which is basically quality of life, there is still a chance. Many times, patients who go on a quality of life treatment because, for example, they're very old, they actually react very well and it opens up new options. Then we can actually try to reverse and treat the cancer, not just make your quality of life better. So what I'm just saying is take action, get a consult with Dr. Jansen, and let's do our very best. It's not there's always a chance. All right.
Indeed. All right. For those of you who wish to have a consult with Dr. Jansen Kalalan or Dr. Mañez, please comment down how to consult. One of our HTS will get in touch with you right away. Okay. All right. For another question. Okay. Another question coming from Ms. Arionda. Is eating rice on a regular basis associated with an increased risk of cancer? Good question.
Wow, the questions that we're getting. I think with our discussion, people are getting more paranoid and paranoid with or at least that I think the proper term is just being careful, no? Yeah, eating rice on a regular basis has nothing to do with the increased risk of cancer. Okay? No. Regardless of the rice that you're eating, may it be white. Okay? The problem here, okay, the increase in the risk of cancer, no? Okay, foods, okay? It's largely from foods of animal origin. That's one. Another one is eating processed food. Processed food consumption, so that includes processed meat and processed carbohydrates. They've seen, no, the researchers have seen that it increases the risk of developing cancer. Okay. Now here's the thing. Our diet causes us to develop certain diseases. Say, for example, diabetes. Diabetes is a lifestyle disease that is rooted on the food that we're eating. Okay, and how frequent we move. Okay, now foods. If you are really fond of sweets, no, yes, you will develop diabetes later on because eating processed carbohydrates, especially sweets, no, it increases your risk of developing diabetes. Now, if you do develop diabetes, then diabetes is the one that increases your risk of developing cancer. Okay, I hope I make myself clear, no? So it doesn't jump. So let's go back to your question. So rice, especially white rice. White rice increases your risk of developing diabetes. That's true. However, then diabetes will increase your risk of developing cancer. Okay, but it doesn't jump. Okay, eating rice increases cancer. No, it doesn't. The relationship is not like that. Okay, I hope you understand where I'm getting to. All right, so it doesn't jump. The rice consumption does not increase your risk of developing cancer, but it do increase your risk of developing diabetes. That increases your risk of developing cancer. Okay?
So it's Doc Johnson, one of the most interesting. I had the pleasure of being in a company of a WHO fellow. Okay, this is Dr. Su Yijian. So he's actually he's a recognized WHO fellow, World Health Organization. So there he was giving us, he was just sharing with us, there's a direct pathology because he's a pathologist. All right, he's a pathologist. So he's the one that went to look for SARS. Hey, I just want to share with everyone, is very interesting. My cousin is actually SARS patient 001 in Singapore. So she stayed in the same, yes, she stayed in the same hotel in Hong Kong where SARS broke out. So she was the first one who actually brought it back to Singapore, right? So not only her, she and her group of friends. Anyway, Dr. Su Yijian was tasked by the World Health Organization to go to China and actually hunt down the source of SARS, and he found out it was the civet cat. I think it's a civet cat, right? He actually said, as a pathologist, it is totally established, right? You eat junk food, you will then develop all these metabolic syndrome, and ultimately it will develop into cancer if you live long enough. So there is a direct link. What Dr. Jansen said, you take a lot of rice, it will cause you to be diabetic. If you're diabetic for long enough and your life is long enough, you will probably develop cancer. So there is a direct link over there, right? So yeah, don't eat so much white rice.
Thank you, Sir Sean. Okay. That's still quite encouraging, okay, for our patients out there. Okay, another question coming from Miss Reno from Leyte. With stage 3 rectal cancer, can I forego surgery after CRT?
Okay, CRT, for everybody's information, is chemoradiotherapy. Okay, CRT, chemoradiotherapy. Okay. Again, no, if you are being recommended chemotherapy, radiation therapy first, okay, prior to surgery, the purpose is to shrink down the tumor, make it easier for the surgeons to cut it out. And if in case the tumors have shrunk already and you're still being recommended surgery, please undergo. So okay, you cannot forego this. All right. So again, I will repeat, for the cancers that are quite common nowadays, so breast, lung, prostate, colorectal, solid tumors in general, no? The reason why we have an increase in survival rates nowadays is because of surgery. Why? If the tumor is not there, the headquarters of the tumor is not there, the burden of metastasis or the risk of metastasis goes down. And one of the common reasons why people die from cancer is because of metastasis. Because the cancer metastasizes to a very vital part of the body where it controls basic bodily functions already. I'll give you an example, no, your brain. Your brain controls what? Your breathing. If your cancer metastasizes to that part of the brain where it controls breathing, guess what? You will not breathe anymore. And when you don't breathe, you die. Okay. So
Yes.
if your doctors, if the surgeon recommends for you to, cut the tumor out, then please have it removed. There's an exception to this. Okay. If your doctor is recommending a surgery wherein that surgery directly cuts down your quality of life, no? Or it significantly reduces your quality of life in such a way that you will not be living normally, and that degree of normalness of in your day-to-day living is not acceptable to you, then that's the time then you can refuse. Okay, I hope you get what I mean. No? So I'll give you another example. Soccer player. Soccer player develops rhabdomyosarcoma on one of his legs. Okay? Rhabdomyosarcoma is cancer of the skeletal muscle. So number one recommendation for that is to cut it out. Guess what? Limb amputation. This is a soccer player. Okay, this is a soccer player. So you cut out his leg. What will happen? Of course, the person would now imagine his life without having to be able to play soccer, which will depress him. Okay, so this is the time when you as a patient, you have to think what you do after getting the surgery. You will be sacrificing a basic bodily function. There will be drastic changes in your life. If you cannot live, you cannot think or fathom you yourself living a normal life, no, a new normal, okay, a new normal life for you, then probably it would be wise not to undergo the surgery. All right, so but this one is entirely up to you. Nobody can force you to undergo surgery. The doctors recommending the surgery would, of course, no, be coming from a position wherein we think that this will save your life. This will significantly reduce your chances of dying from the cancer. That's why we're recommending it. Okay, but on the behind the scenes, of course, it's your body. It would be entirely up to you to consent to the surgery, knowing the consequences of having underwent such surgery. Okay. Yeah.
Thank you, Dr. Jansen. Okay, so for another question coming from
I
yes,
just wanted
yes, Sir
to
Sean.
add, since we talk so much about surgery today, I just want to throw out an option there, right? In case, because I also noticed there was a question that asked, Doc, where is your clinic, Doc? So maybe, Doc, right now, maybe you can just tell people where are you located. Yeah.
Okay, my clinic is at Alta Integrative Medicine and Wellness Complex that is located inside Perpetual Health Medical Center, Las Piñas. Okay, so
So
that
it's in
is
Metro Manila.
it's in Metro Manila. It's in Perpetual Medical Center Las Piñas. I also have telemedicine. So if you want to go for a teleconsult first, just you can message me in my Facebook page, Doc Jansen Kalalan, or just comment down here in this
Just
video.
comment down in the comments today and someone will reach out to you and help you schedule a appointment with Dr. Jansen. So one of the best things that came out of the pandemic is the teleconsulting, right? So you don't have to spend 4 hours traveling to the hospital, another 3 hours waiting in queue just to see Dr. Jansen. You can do it from the comfort of your home. And because the first consult is usually a lot of understanding questions, and for patients who are already undergoing cancer treatment and you want support, it may not be necessary to see you physically. So have an online consult with Dr. Jansen, and if it's necessary, then make that journey and the effort to come and see him in person. So that's one. Okay, I brought this up because sometimes many of us have this worry whether the surgeon that is recommending surgery to us, do we really need the surgery, right? So sometimes it's a bit about comfort. So I want to encourage you, number one, if you want us to recommend a surgeon to you, I sincerely would recommend Dr. Jimmy Katapia. So number one, Dr. Jimmy is like a super surgeon and he's always operating all the time. He actually loves his job a lot. What's really important is that although Dr. Jimmy is a surgeon, he also had mentors during his medical career, especially when he first started, who were more natural oriented. So he had influence in his medical career as he became a surgeon. He had influence that made him also appreciate palliative and natural approaches to healing. So this makes him quite a unique surgeon. He's not the surgeon that is totally Western oriented with drugs only. That's why he is very open to be able to share with you a more holistic point of view. So for those of you who want a surgeon that, obviously, if you're afraid of surgery, you're most likely one of those who also want a surgeon that appreciates not doing surgery. And Dr. Jimmy Katapia is one of them. So he will give you a very objective advice. If you do need surgery, he won't hesitate to operate. Right? But if you don't, he's one that would not recommend when it's not necessary. And of course, if you're just afraid, very reluctant to do surgery, then I think Dr. Jimmy's final advice would really help you make a decision, because he's very understanding and very holistic. But if he thinks that you need surgery, then I think that's probably a good advice. For any of you who want to see Dr. Katapia in person, you can see him on March 16. But of course, if you have a condition today, please don't wait until March 16. Just type the message in there, say, I would like to consult Dr. Jimmy, and then we can help you arrange that, okay? Yeah.
Thank you, Sir Sean. Thank you, Sir Sean. I just want to add this, sir, because for those of you who wish to have a consult with Dr. Jansen, I've seen how he does his consults. He's very meticulous. He goes even deeper to what you are taking right now, supplements or pharmaceutical medicine. So that's how he is, and very, yeah. All right. Okay. So for our next question, coming from Miss Shirk, is it safe to eat at least 2 slices of fresh pineapple every day? Does it help with my constipation?
Oh yes,
Oh.
pineapples are very high in fiber, and if you really love pineapples, yeah, by all means, no, eat your pineapple. It's just that pineapples can be quite acidic, especially in the mouth, no. But if you can tolerate eating pineapples, yeah, and if you do enjoy eating pineapples, yeah, by all means, go. Even if it's every day, go. My mom even eats pineapples for lunch. And it's actually one of the ways on how she was able to keep her weight down, no, throughout the decades. Really amazing.
Great tip. Thanks, Doc. Okay, another question coming from Miss Anjoy from Cainta Rizal. Asthmatic, constipated, bloated, and has hypothyroidism and diabetic. I'm always bloated and constipated. I just underwent umbilical hernia surgery. Can I still undergo colonoscopy?
Yes, you can. You can. You can definitely undergo colonoscopy. Some things that some conditions, no, wherein you won't be able to undergo colonoscopy is when you have obstruction. I think that's the only or you're prone to bleeding, no? I think those are the only two contraindications for colonoscopy. So yes, definitely you have to you can undergo colonoscopy, no? And if you are at that age, meaning 50 years old, then it's about time that you undergo screening or routine colonoscopy to check for polyps. So yeah, by all means, even if you have all those diseases, my God. Okay, so yeah.
Dog,
Colonoscopy.
that's a fun. Junie Kim asked a question. Pineapple on pizza. I think that's a no. Okay, we are very playful participants this evening. Love your questions, guys, and thank you so much. Wow, the number of people that are still watching us live is a very good number tonight. So thank you for staying with us. I hope that you're enjoying yourself. Please, we still have a bit more time. Let's answer a few more questions.
We will. Thank you, Doc. Thank you, sir. Okay, next question coming from Miss Janice from Quezon City. Doc, what is the difference of acid reflux and heartburn?
Acid reflux and heartburn, the main difference, heartburn is the symptom, acid reflux is the disease. Okay, did you understand what I mean? Heartburn is what you feel, no? So if you have heartburn, most likely it's because of acid coming from your stomach. So it's acid reflux. So that's what we call it. And how you feel is the heartburn. That's what you feel. What we call that is acid reflux. I hope you understood what I said, no?
Excellent. Thank you, Doc. That's pretty clear, guys, right? Okay, so next question coming from Miss Rochelle. How to cure a bad breath and being bloated most of the time?
Oh, that's a very practical question, Doc. How do you cure bad breath?
Yeah, so one sign that you have bad breath is if you are if you are not eating the right food, no? So if you have this kind of problem, try increasing the amount of fiber that you're consuming. So plant foods again, try to reduce the amount of meat products that you're consuming. Okay, and if you do have bad breath, probably you have to get your mouth checked, go see your doctor, ENT doctor, go see your dentist because there might be some problem, ongoing problem with your tooth, some problem with your mouth, no? Because we have what we call as tonsil stones. Tonsil stones causes bad breath. I mean, these are stones that are lodged in your tonsils, which can be quite painful and it stinks really. So please have your mouth oral cavity checked as well, no? And get your teeth cleaned. So that's one tip. So the other one was the other question, bloatedness.
Correct, correct.
Yeah. Okay. For bloatedness, sometimes it's because of dysbiosis. Dysbiosis is when your gut microbiome is not diverse enough, no? So one tip for that would be if you don't want to spend money for with supplements, then go on a plant-based diet, at least a plant predominant diet. Another one would be try to reduce the amount of legumes that you're consuming, especially beans. Beans can contribute to bloatedness. If you do experience bloatedness, drink more water so you flush your bowel will move more frequently. Another reason for bloatedness is when you have hyperacidity. Okay, so that's for that you can experience dyspepsia, discomfort just below your sternum. Another one would be gallstones. Gallstones can also cause bloatedness, but if you have gallstones, then you should also experience right upper quadrant pain, right upper quadrant of your abdomen, no? So just below your right rib. So that's where your liver is located. If you have gallstones, that area of your abdomen would be painful. So those are just some, no? But if you have bloatedness and you're not experiencing any of the symptoms that I have mentioned for acid reflux, for hyperacidity, acid reflux, and the gallbladder stones, then you can consider taking in a probiotic supplement. Okay.
Sir Sean, would you like to add anything?
Yeah, I just want to say that honestly, speaking, when you go on a more vegetable-based diet, even your sweat and bad breath will actually improve, right? So this one, I can definitely tell you guys because I'm like a carnivore, all right? Until I recently made the switch to 90% vegetables, and I do notice, and like I said, I exercise a lot, right? So I do find that my sweat is less acrid, less acidic smelling. So it's like very mild now compared to in the past. So definitely anybody who is struggling with body odor or bad breath, your diet is one of the primary causes for that. All right. So if you switch to a more vegetable-based diet, you could see great improvements. All right. If your problem was not what's that, oral health, right, or oral cleanliness, do look into that. I still remember, Doc, many years ago, I met this person who was totally vegan. He was like a Taoist, like almost a monk. And then his girlfriend would tell us, he has no smell. That's what she said. He has no smell. So I realized that really is one of the effects. I guess it's also true that when you eat vegetables, most likely you're not eating any preservatives like sausages and things like that. So you're eating less junk. So that really results in a cleaner smell, hygiene. Yeah.
And the skin improves too, right? Sir
Yeah, the
Sean?
skin, the pores will close and everything. Oh, Doc, McQueen asked a question that we were talking about. Ozempic. We were just talking about Ozempic, hold on, but let's look at Wayne's question, Sheila. I think that's one is cancer related. So let's talk about cancer first. Sheila, can
Okay.
you
Okay,
use
there
it?
you go. Okay. Actually, I have my next question to ask right now is for cancer cells, malignant
Correct.
breast
Okay.
cells, what kind of PPARs should a person take for this kind of condition? Coming from Ms. Rogela Cortez.
Okay, depends on what stage. Okay. For cancer, for stage 4, I typically recommend either the liquid or the powder. It depends
Absolutely.
on what other treatment you're undergoing and depending on your budget as well. For the earlier stages, it's always powder. Okay, like stage 1, stage 2, it's always powder. But I don't just use or recommend one single protocol. Okay, it has to be used in conjunction with the other ones. Okay,
Okay.
so those
So
are the products that I would recommend. Always the extract for cancer. So either liquid or the powder.
So I want to stress this part here. Personally speaking, based on my experience with multiple forms of products and protocols out there, I would very confidently say that taking the PPAR, specifically Simply Nature PPARs, is the one of the best, if not the best, foundational. Right? That means you really start with this, okay? But don't stop. Right? Don't stop. This is one thing I just want to add, right? You can definitely add a vitamin C protocol to it. You can definitely add lots of other, like Doc was just talking to me about cumin, right? Cumin. Right? And then there has always been turmeric and things like that. No, all these things that you read on health blogs and you hear from health wellness experts, they are true. They are true. Okay, they really help in your fight against cancer, right? Now, however, are they strong enough for very measurable therapeutic effect? That depends on your foundational health. So if everything in your body is working well, then when you take turmeric or cumin, then curcumin, then you will see even better results, right? But if your foundational health is very weak, then taking all these healthy foods, you don't see that pronounced effect. So that's why I would say pipa powder and extracts. The extracts are the very important foundation, but you don't have to stop there. You can, on top of that, you can go for lifestyle changes. You can go for other supplements to add to that. And if you want to know how these supplements work together, will they have a contraindication, which is the best combination, then I would recommend you having a consult with Dr. Jansen, because this is his area of specialty. I'm specializing in PPARs, right? He specializes in a wider range. So he will be the best doctor to share with you after you use the PPAR powder and extract liquid, what other supplements can you add so that you have an even better fighting chance. Again, my last comment before I finish up this particular question is this. Cancer is somewhat of a battle of the wallet. So, if your budget is bigger, you can do more, right? Doesn't mean that if you do less, you won't beat cancer. But it's really just the case that if your budget is bigger, then go all out with all the options possible. And if you want to explore all options, just make a consult with Dr. Jansen.
Exactly. Thank you, Doc. Thank you, Dr. Jansen and Sir Shyan Lim. Okay, another question. This is the one coming from Ms. Weng Carino. Doc, for cervical cancer, chemorad and brachytherapy is done. Before the fourth or last session of brachytherapy, only 1 cm left. But 2 weeks after last brachy, it became 2 cm. Then the onco said maybe it is only inflammation and it will still shrink, so need to check after a month. And every month, in 3 months, how long will we wait? The effectiveness of brachytherapy?
Yeah, I'm with your onco here. I think it's probably because of the inflammation. That's why it increased in size. It doubled in size. Okay, so I'm thinking also of inflammation. Now, how long will you wait for the effectiveness of brachytherapy? It depends on each patient. So I cannot say a specific period of time. So what I will recommend is to monitor. Same what your onco told you. Monitor the size every month. Okay, if it's really an increase in size or it's really because of it's just because of inflammation. Now, if it's because of inflammation, can we do something to lessen the inflammation? Yes. Okay, you have your antioxidants, all right? PPARs, I would recommend PPARs for this because PPARs is a very strong antioxidant. Okay, and since you just finished your brachytherapy, and typically once you're done with brachytherapy, that's the last of the treatment, no, that you would have to undergo. it's the best time to help your body recover from the effects of the therapy that you just underwent, no? So yeah, that's my position with this. Okay.
Yeah,
Sir Sean?
to add to Dr. Jansen, not only is PPARs a very, very strong antioxidant, it specifically actually triggers the pathway that modulates inflammation. So when you modulate inflammation, you do more than just antioxidants. It is also a very powerful antioxidant, so don't get me wrong. On top of that, there's an additional mechanism where it actually modulates your inflammatory responses. So that's why it's really good. Doc, there's this question I guess is very specific for you. Is it safe to take PPARs with palbociclib?
Palbociclib. Yes.
How come you can get it right, Sheila, and I can't? Doc Jansen's laughing. Okay.
Yeah, I have patients who are on PPARs and are taking palbociclib. Palbociclib is Ibrance for everybody's information. Okay? Yeah, I have one patient. Actually, this patient of mine just sent in her latest scans, no? And there's one tumor, I think it's in the liver, if I remember correctly. My gosh, I can't remember specific details because there's so many. I think it's in either the liver or lungs, no, wherein the tumor shrunk down by half.
Wow. Was this the one that you were sharing with me during dinner just now?
Well, yes, yes, yes.
Wow. What a
That
coincidence that the question came up. Wonderful.
yeah, palbociclib. Yes, it can be used together. This patient, however, has been suffering from low WBC counts. But upon further inquiries, it seems the patient is quite healthy. The patient is working. She goes to her office every day. She didn't catch any flu-like symptoms just yet, so I think the PPARS is helping her quite good. But I'm still worried with her low WBC count. That's why we're keeping a close follow-up on her. Actually, I just requested for another CBC because she just finished her PPARS powder, no, just recently. So more info to come later on. Hopefully we see an uptick already with her WBC counts. Yeah. So yes, definitely you can use them together. So this is also evidence that yeah, it works, no? It works well together because you see a reduction in size of the tumor. And take note that this patient is stage 4 breast cancer. Okay?
Wow, stage 4. That's really great. That's very hopeful because that's what many people will consider terminal stage, right? So to see the thing shrink, wow, fantastic.
Amen. Right. Doc, just a follow-up question quickly. You've mentioned before that there are so many chemotherapy drugs wherein if PPARS is taken alongside it, it will make it more effective. Is palbociclib one of those?
Yes, actually palbociclib is not. Palbociclib and PPARS have different
Mechanisms.
mechanism of action. That's the term. They have different mechanism of action, so they don't interact. It doesn't make one protocol more effective or diminishes the other. There are chemotherapeutic drugs that work in synergy together, no? Like capecitabine. Capecitabine is an oral chemotherapy drug also used for breast cancer and other types of cancers like colorectal cancer as well, no? Wherein if you use PPARs and capecitabine together, it potentiates each other's effect.
Thank you, Doc. Okay. Another question coming from Miss, I'm guessing this will be our last question for tonight. Okay. Coming from Miss Jen Chan Ang. Can PPARS tablet increase blood count? How many months of intake to take the effect or to see the effect?
Okay. PPARS tablets, I find it the concentration to be too low. If you want to increase your WBC counts, go for the powder or liquid. I find PPARS tablets too slow.
I totally agree with Dr. Jansen. So here is the main summary, right? If you want therapeutic effect, definitely the extracts and concentrates. So if you have a medical condition, minimum soft gel capsule. I mean, serious medical conditions. So things like mild diabetes, all this, the tablets is absolutely fine. Even eczema, the tablets is fine. But let's say your eczema psoriasis is serious, then it's the soft gel capsules. So for things like if you need to increase blood count, be it red blood cell count and white blood cell count, that means you have a medical condition that is, I guess, at the very least, most likely urgent. All right. So once you're in that category, you want strong therapeutic effect, something that is measurable, not less dependent on individual bodies' constitution, then definitely the extracts. I want to let everybody know, in my personal perspective, the tablets are our best products, really. The reason because it's full of nutrients. So if you are a healthy person or a person on maintenance level, the tablets are so good, so good. You get all your nutrients and you do get a small amount of PPAR agonists, enough to maintain your good health. That's why we always pair up our powders and liquid extracts with the tablets, all right? So if you speak to Dr. Jansen or his HCS, Ms. Beth, or Sheila and her team, they will always pair up the extracts with the tablets because the tablets are really like the superfoods. It's something that you can really build your health on. However, for therapeutic effect, that's why we go for the extracts, all right? That's why we go for the extracts.
Exactly. It's actually our help to our patients so that, our other patients, they purchase vitamin C on the side, vitamin A on the side. Our tablets are actually full packed with nutritional content. So there you go. All right. Okay, Sir Sean, and of course, Dr. Jansen Kalalan, just before we say goodbye to our viewers, I'd like to ask for a very quick parting words from each one of you. Who would like to start? Shall we start with Dr. Jansen?
Sure.
Okay.
Okay. Okay, yeah. So I just want to thank everybody who's I want to thank everybody who stayed with us until this late at night, no. Yeah, I hope you learned a lot with what we've discussed. It may seem quite overwhelming, but rest assured, we have another episode coming next week, so you can ask more questions. Okay, this is your chance to ask your questions. Because this is for free, okay? But of course, if you want a more detailed, discussion, please feel free to set an appointment, schedule with us, no, so we can help you more. And don't give up. There's always something that we can do for you, even if it seems that you've exhausted all options. Just comment down at the comment section. Okay, so that's it, everyone. Good night and thank you. I'll give the floor to Shan.
Thank you.
I want to say that I truly enjoy our Ask Me Anything segments. And what I find really different about our Ask Me Anything segments is really the presence of Dr. Jansen. There are many health talks on radio shows, on podcasts, on YouTube. These are the so-called health gurus, right? That we always listen to. They teach, because when you want to hear about wellness, you always have these health gurus. And what I like about our program is that we have a balance. Dr. Jansen talks about wellness as well. I'm in that area with PPARs. However, it's not easy to find a wellness program or a health question program where the person actually can answer you about the drugs. When the host can pronounce the name of the drugs without difficulty, where you can actually ask the person that's doing the program about your chemotherapy drugs and everything. I think that's so refreshing, and we can do that because we have Dr. Jansen with us. And not only Dr. Jansen, but all our doctor guests. And I think that's what makes the program very different. So I would like to let everybody know, take full advantage of this, because you are actually getting medical experts that are able to answer medical questions, not just wellness questions. And these experts on our panels are very balanced in their approach. Dr. Jansen is an integrative doctor as well, so it's wonderful that he can talk about chemotherapy as well as how to treat your cancer naturally. through lifestyles and supplements like Simply Nature Pea Bars. So I'm looking forward to more such sessions. Thank you, Dr. Jansen, for joining us and making our program so different. And I'm sure all our viewers also appreciate that you are here and they can ask you medical questions, not just wellness questions, and they can be confident of your recommendations. So once again, if you need a consult with Dr. Jansen, you don't have to spend hours going to his clinic. You can arrange it with a quick teleconsult where everything will be convenient and you won't queue or anything because the appointments are fixed ahead in time. So to do that, just make a comment in the comment section and someone will get to you. Thank you, Sheila.
Thank you, Sir Shyan. Thank you, Dr. Jansen. Thank you so much on behalf of our viewers for answering all our questions every Thursday. And of course, to our viewers, thank you so much for throwing your interesting and very amazing questions that can help actually the community to be a lot more healthier. Okay. Now, at this point, I'd like to invite everybody for our next webinar this coming January 25. That's also Thursday, 7:30 p.m. It is entitled Breast Cancer 2024 Protocol. Okay. At this point as well, I'd like to invite everybody, calling all cancer patients, survivors, and advocates. Let us all come together to explore the latest advancements in cancer treatment and engage in a multidisciplinary experts dedicated to enhancing your well-being. So we are actually inviting, yes, Dr. Jansen Kalalan will be present, Dr. Jamie Katapia, our surgical oncologist from Manila Med, and of course, Sir Shyan Lim will all be present as our panel of experts who will answer all our questions face to face. Yes, definitely. You can go actually register for a face-to-face pass. And of course, this is also available online. Okay? All right. Now, at this point, I just want to say great news to everybody because you can still avail of our Power Pack and Kickstart gift packages for detoxification and immune system booster through complete nutrition. The management has approved buy 10, get 1 free. So don't wait for any other birthdays or any other occasions this year to come, because as early as now you can actually get them. Okay, this is perfect for your parents and for yourself and your loved ones. So once again, don't forget to like and follow all our social media platforms and subscribe to our YouTube channel to keep yourself updated, not only with our latest events but also our latest success stories. Our products are available via Shopee and Lazada, and of course directly from our BGC office. We are open from Mondays to Fridays. Okay, there you go. So thank you so much once again for joining this webinar, and we hope to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.